Get ready. You're about to experience the life science effect. The most influential players in the biotech, pharma, and medical device industries, bringing you their insights and inspirational stories. Are you ready to boost your career? Ready to set your medical innovation in motion? You have arrived at the right place. Every week, another industry leader, more insights, more inspiration, and tips you can implement right away to make your mark on the world. And now, here's your host, life science veteran and senior leadership consultant, Steve Vinson.
We're here today with Euan Cameron. He is the CEO and founder of Cohesion Medical. I'll let you go ahead and pronounce your name correctly. I apologize if I butchered it.
No, you did a very good job.
Good.
It is Euan and it is Cameron.
Great. Euan's from Scotland, from Glasgow, and he's here as part of a collaboration effort with the Indiana Health Industry Forum. But I'll let you go ahead and tell us about your company, tell us about you, your background, what gets you up in the morning, and if you want to talk about your personal life, that'd be wonderful as well.
Yeah, sure. So I'm Euan. I'm originally a bioengineer from Scotland. I studied the postgraduate engineering there. Liked the fact that medical life science engineering was a bit more interesting and a bit more socially powerful than perhaps fixing dirty mechanical engines. So bioengineering was my background. Did a bit of time with Johnson & Johnson, mostly in the UK. That was in their orthopedics and in Ethicon. And went on to do a PhD, which I never quite finished because I got slightly distracted by the internet. So 30 years ago, that was just beginning to happen. And I thought, wow, this global phenomenon is really, really exciting. And I kind of left my PhD studies and set up a back bedroom startup, mostly around developing applications for the internet. And some of those applications were for medical purposes. And then we developed some interesting technology about 10 years ago around the use of our digital platforms for precision medicine. And that got some of our enterprise agencies quite excited. And they kind of gave me a big push out of the back bedroom and a bit of encouragement. And I raised a bit of money and I set up Cohesion Medical to develop connected digital health solutions for healthcare, life sciences, and to improve patient experiences.
And you obviously enjoy it.
Oh, I love it. I think this is my time, I keep telling myself. I think I spent a lot of my life slogging, doing small projects for other people, even though I was self-employed and still running my own business. I never felt the work I was doing was my products, and there was always a service I was providing to someone else. So suddenly having the opportunity to say, hey, we have an idea that we can transform into a solution, and that solution is wanted, and this is our innovation, really is quite a satisfying kind of feeling. It makes you feel you're doing something powerful, something positive, something personal, and it gives a kind of, it's my caffeine shot in the morning to know that I'm going to do something different today and it is going to have an impact somewhere.
Fantastic. So you had jobs, J-O-B jobs, and then you took the leap and went off and started your own thing.
Yeah.
You said you raised money, but I imagine it was still not 100% comfortable, or has your personality matched the typical entrepreneur?
Yeah. I think given my background and the kind of the setup in Scotland, I wasn't well connected with the right people. So, but I did have a lot of ordinary Joes who knew what we were trying to do, some patient groups, some clinicians, some family, friends who had seen what we'd embryonically grown and actually had faith in us. So the money we took was from very ordinary, friendly investors, but it was enough to get us kind of bootstrapped. And I think it might be a bit different in the States, but in Scotland, it's very difficult to raise funding for investment, particularly around healthcare and especially around digital health and even life sciences. It has to be a very targeted area before you'll get an investor to kind of put money in. But I had a lot of grassroots support, and actually that was quite a motivational driver, you know. So we had the feeling that there was from a very early stage, how would they say, a moral compass to what we were doing. So with grassroots, patients saying, this would be good for me, I would like to support you, how can I do it? Putting some small amounts of money in, and then having a kind of collaborative investor shareholding going in, like, was really just a kind of like consolidated our sense of purpose. It made us realise we weren't just doing this to satisfy a big VC group who just were seen us as bucks. We had a very bottom-up, grassroots, patient-driven kind of driver for why we were doing what we were doing. And yeah, that's again, that adds to my kind of like why I get out of bed in the morning.
Yeah. When you have, when you first started saying the bootstrap piece, I thought, well, yeah, that would be really motivating. You just took people's money and you want to return it. But then you surprised me, and it shouldn't have surprised me, but you took money from patients who said, this is a solution that would help me. So it's so much bigger than the money at that point, right?
Yeah. So it's not quite crowdfunding. We didn't approach it, we didn't want anonymous people. We didn't want hundreds or thousands of people just chipping in, £100 here. What we really have is something that's small crowd funded, and it's by people who have been affected by cancer personally or within their family, or even medics who have an inside experience of the inefficiencies of healthcare and how that impacts on like the patient journey and the delivery of a better health service. And in some cases, it's just people who kind of like thought, go for it, Euan. We like your determination, and here's a wee 5k or 10k to kind of like put in the pot and kind of like, see how far you can go with it. Yeah. So that's good. I feel there's people behind me, even though they're not physically behind me. As part of my team, but there is a kind of like a base of, like, as I said, a kind of a moral compass, a support for what we're trying to do that from the grassroots that makes our purpose quite purposeful. That's
so unusual, I think. Maybe it's not as unusual as I think, but just to have that level of motivation behind you. Have you gotten, I have no idea how far along you are. How far along are you? Are you close to a solution? Is it already out there?
Yep. So most of the technology was originated from a project we did for NHS Scotland in precision medicine. And I think their understanding of what the project was about was more just from a clinical perspective, and they didn't actually see the real value from a patient perspective, but also even a commercial perspective of what the technology platform could actually deliver. So we've had like 10 years of working up what we've developed, and from the last 4 years, so Cohesion's been running 4 years, so we're still quite early stage. We have had these platforms implemented in aspects of NHS Scotland in not full solutions, but like components of, just to demonstrate proof of concept here, proof of concept there. So the platform itself, we can show it's fully developed in some areas and being piloted, and we've got proof in patients, and then in other areas we've got technology that's working in principle, but maybe untested in practice. But if you step back and you looked at the frame of the solutions that we've put together, you can see a kind of working, not just a solution, but a working, so probably somewhere between the upper reaches of concept and just slightly below a commercial solution. So, but we can actually demonstrate that this drives, good patient experience, efficient clinical workflow, and really insightful, real-world, real-time data analytics for pharma. So we can show that.
We in the US are, and I don't know if it's the same in the UK, but the big word on the street is efficiency and lowering costs, and any solution that can help lower costs, which paradoxically also helps the patient at the same time. So is that something it'll help lower costs as well?
I mean, efficiency drivers are always a key interest from like healthcare providers, whether they be public or private. Can you reduce our costs? Can you make us more automated? Can we share data more effectively? Can we recycle information to make them everything a bit more cost effective? Yeah, we can do that. But for us, we really want to just reach out and grasp healthcare providers and saying, reducing costs is just like half the equation. What you really want to do is increase the value in your organization. So some of that value is cultural mindset, all people based, but the other part is, can you see value innovation in what you do? And I think one of the things we like to offer through our solution is that value innovation is got a couple of components: reduce costs, but also increase opportunities to generate revenues that maybe you hadn't actually thought about. So that's a conversation and a educational process and a kind of dialogue that we've established with some healthcare providers who've only been driven by reduce my costs, rather than getting them to turn around and say, hey, you've got value revenue opportunities if you just looked at this slightly differently. And the key thing for us is actually some of the value revenue opportunities are actually significantly greater than the cost reductions. So there's as I said, a conversation or a dialogue, maybe also I'd say an argument. Because it can be quite heated when people are just trained. And I think this is where the culture mindset comes into healthcare and life sciences, that people are just trained that push costs down rather than look for opportunities to make new revenues, and how do you make those new revenues. So I think what excites me is actually what Google's doing. I think they've been quietly progressing with a kind of a vision of the world around data-driven systems, and that kind of, and mostly it's been out of health, but you can slowly see them move in with Verily and other initiatives towards a kind of like health and life sciences. And I think their approach is very much a value innovation sort of approach. It's not just about reducing costs. So we mirror and align a bit to that, but I think we've got some interesting stuff that maybe even Google hasn't quite thought about yet.
Well, that, and then that could be your exit plan. Google finds out about you and pays you $1 billion.
That some people have said that. Realistically, we're small enough, or so small that we don't challenge Google's dominance. But we have reflected what we believe is some of their thinking, and how we develop our technology, what our technology is trying to achieve. And at the same time, maybe, if Google kind of like gets there first, they might actually see, there's parts of what we've done that might actually fit very nicely within the Google framework.
One of the things I think Google, Amazon, Uber, some of those companies that have grown really quickly over the last 10 years. One of the things I think they do better than other large corporations is they recognize that when they started, they were entrepreneurs and they were startup, and they could innovate. But now that they're large, they're not going to be as good at innovating as the new startups and entrepreneurs. And so you see them all the time. It's their make versus buy decision seems to be biased toward the buy because that's where innovation happens is in the smaller companies.
Yeah, I totally agree. You know, I would also say innovation happens better in small companies that are extremely lean on resources. You know, so your solutions are creativity, you know, or and determination, you know, and sometimes it's not about, you know, having a startup that's got a big backer who puts in a whack of cash at the start. And, you know, when we were at Purdue yesterday at their foundry, which was, well, really impressive. Like, I like how they've streamlined and simplified almost perfectly the kind of the engineering process of innovation to impact. You know, like you could see, you know, the tougher it is, you know, maybe it's a bit like Rocky, you know, like the kind of you're more likely to succeed as a world champion when you've had a really deprived, tough kind of like upbringing. And I think sometimes small companies are a bit like that. You know, the harder that is to start, the more determined you are to succeed and the more creative you are with the solutions that you design and develop. And yeah, I think Google maybe, or Apple or Amazon, you know, they probably realize that, you know, you don't want you know, too much of a soft-bellied startup. You want something that's lean, hard, kind of like got a bit of pit bullness about it, you know, and really wants to succeed and, you know, will train harder, work harder, go up steps in Philadelphia more often than anyone else, just to build that kind of, like resilience and mentality and mindset of, we're doing something good. We believe in it. We've got other people believing in it. And at the same time, just the kind of the motivation of why you're doing it is like, you know, creative and for the right reasons.
Yeah. There's a paradox. And let me ask if you see this as a paradox. The smaller companies are more willing to try different things and maybe fail.
Yeah.
And the paradox being the consequences of failing as a small company could be pretty dire. Maybe you've taken a second mortgage on your house or something like that, as opposed to failing at Google, who has billions of dollars and who cares, we'll just do another project. Yet, I find at the smaller companies, people are more willing to take risks than at the bigger companies. So do you see that paradox and how would you explain that and why is it?
Yeah.
Why is that?
I mean, I think you're right. I think, you know, if you're a small company, you should partly be more risk averse because actually going out of business is so much closer to your home. You know, and it doesn't take much for, like, you know, 1 month or 1 week of bad news to put you out of business. So you do actually have to be quite risk averse. And paradoxically, just as you say, you also have to be totally risk taking. You know, on one hand, you could go out of business any moment. On the other hand, you've got to challenge everything. And if it doesn't work, ensure that, you know, if you hit the floor, you get back up again and you're still in business. And you've got to do that more often than maybe big corporates, and, sort of executives who are sort of running their innovation departments even have to think about, you know. So it's, but maybe that makes us very good risk managers. You know, we know just how far to go without like putting ourselves out of business and making our staff unemployed, but actually pushing a boundary to get like something innovatively done, whether that's in the technology, whether it's with the customer, whether it's with our kind of supply chain, whether it's with our kind of staff approach to kind of like what we're trying to do. You know, just pushing that envelope is something I think small companies can do really well and explore and experiment. But also realize, you know, you do not want to take one step beyond not being able to get up, you know. So getting into the ring and getting knocked down in the first rounds, in the first 15 seconds, that's not a good start. You have to know you're going to do 15 rounds and you're going to hit the canvas lots of times, but you need to get back up, but you also need to punch, but you don't want to take too many of those punches as well, or if you can avoid it. So yeah, having a very risk managed kind of approach is, I think, best. Yeah. I think someone in Scotland once said of me, I was the most risk-averse radical entrepreneur they've ever met. And actually, I think that's actually a good way, I think, for someone leading a small company to be.
Yeah. Knowing which, well, you avoid the stupid risks.
Yeah.
So that you have the energy and money and time to take the big gambles.
Yep.
Right.
Yep.
I love that. I don't think I've heard it put quite like that. So
okay.
I love it.
Good.
It's great.
Good.
Is there anything that you were hoping to tell me, but I didn't ask the right question?
Well, maybe I should have you kind of alluded to at the start, what gets me out of bed, what drives me with this, and there is that kind of like business driver. And I think you were also asking about like risk, I think for me personally, I think there was a lot of, before I started Cohesion, I really wanted to ensure I did my happiness checklist. I wasn't doing the business to make, billions and be happy once I've got billions. It wasn't a case of I need to drive my ego and be feted by my employees and people out there who say, wow, great ideas, and just kind of have that whole stroking of my male ego to be told, yeah, you're special. I think for me, when I started, and every day's much the same kind of like reflection of, have I got everything on my happiness list checked? So have I got a partner who's going to stand by me, who's going to love me whether I fail or succeed? Have I got a good support network of people outside the business to keep me sane, to keep me distracted with like what else is happening in the world and what is important? Do I have that kind of reassurance that, I'm not doing this to change my life. My life is happy already. What I'm doing is going to change other people's lives with what we're doing. And I think, again, getting back to motivation of why are we doing something in healthcare and life sciences, it really is driven by the change you can make. So I'm not trying to change myself. I just want to see solutions that make things better for patients and better for clinicians, and maybe even introduces new types of medicines and maybe a shorter development time of like medicines getting to markets. And I think that's the kind of impact that I'd like to see happen.
Great. That's a great note to take a break on.
Okay.
I love it. That's absolutely amazing. And we'll come back and we'll do the rapid fire round.
Sure. Great.
We are very proud to have the support of the Indiana Health Industry Forum here at the Life Science Effect. They have been with us since day one. IHIF provides guidance and leadership on public policy issues that contribute to innovation in the health science sector, deliver therapies to patients in need, and further the development and growth of their member companies. IHIF also works with the government and other groups to support specific initiatives and legislation. Also, if you need a connection in the health industry, give them a call. Go to ihif.org and they will hook you up. They have been a tremendous supporter of ours, so thanks again to the Indiana Health Industry Forum. Go check out ihif.org and support them like they support our life science community. Now, back to the show.
We're back with Euan Cameron, and I'm really inspired to get out there and make a difference for people. But first, we have to do the rapid fire round. Are you ready?
I am indeed. Fingers on the buzzer.
Finish the sentence. The one principle I will never compromise is?
Ethics.
Great. What should every aspiring leader stop doing today?
Talking.
What should every aspiring leader start doing today?
Listening.
And what are you reading right now or listening to or?
Yeah, it's kind of interesting. Before I started Cohesion 4 years ago, I probably read about 3 books every week. And it's part fiction, part fact, part business. Have I had as much time to read now than I used to? No. But has my library of business books expanded? It sure has. I've now got probably more business books over the last 4 years than I ever had. What ones I really quite liked were just all the stuff on business model canvas and MVP and Bill Ollitt's 24 steps for disciplined entrepreneurship. But I will confess, I don't actually read them. Oh. I buy them, I flick through, I pick out things that I need. So it's very much a magpie approach to reading, so in my
sort of
mind,
reference books.
Yeah. So it becomes less reading and more referencing, as you say. But one book I did complete quite recently was Matthew Syed. I don't know if you've heard of him over in the States. He's got a selection of books out all around leadership, belief, creating change, using systems to sort of like drive those changes. And the book I read most recently from him was Black Box Thinking. Okay. So Matthew Syed's a really interesting guy. In the UK, he's came from quite a poor background in Wales, I think. Part immigrant, kind of like sort of second generation. But he took up table tennis or ping pong, or I'm not sure if you call it.
We use both. It's interchangeable, yeah.
And he became a UK champion at that.
Wow.
And unfortunately, he had suffered a couple of knockbacks in health, and actually ended up sort of retiring early. But it allowed him to sort of like, query how come. So maybe this is another like the Rocky story of ping pong.
Yeah.
How did he come from such a challenging background and make it all the way to become like an Olympic champion? What made him special from his peers, who he grew up with? What made him this outstanding sportsman? And he's taken a lot of that kind of reflection in how sports develops a certain mindset. And I have to say, this is one of the things that really impressed me about Indiana. And when we were up visiting Purdue University, I see the correlation between sports, leadership and success, whether it's in any field, not just the sports, whether it's business or academia or, even home life. So Matthew Syed's Black Box Thinking is really, how do you build and nurture that mentality of doing things right, not necessarily right as opposed to morally right, but actually how do you build a certain sort of perspective on the world where you can get things to fit that allows you to make step changes towards a goal that you're setting yourself. And interesting enough, in Black Box Thinking, he applies this to healthcare. Oh, wow. And to show how some of that thinking of not just about success, but on a personal level, can translate to an organizational success. And so he gives a lot of case studies, mostly from the National Health Service in the UK, about how some of the healthcare organisational change is needed to make them go through the same step change process. How do you look at things not just from a cost perspective, but from a value perspective? How do you engage and empower your staff to lead change? How do you make effective patient experience happen? So I do recommend that. And as I said, if you want to know more about how to be a good ping pong player, you also pick up a couple of tips there too.
It's in there. Black Box Thinking, Matthew Syed. Thank you so much. Well, this has been great, Euan. Thank you for doing this. I appreciate it. And you're welcome to come back anytime.
Great. I think I might be.
Excellent.
Well, thank you.
You have just experienced the life science effect. Who else needs to be inspired? Tell your friends, tell your colleagues, tell your boss. It'll make you sound smarter, and it might even get you that big raise. thanks to our presenting sponsor, BPM Associates, helping life science companies design, manage, and execute their most complex projects. Check them out at bpm-associates.com. Thank you for listening. Go to the lifescienceeffect.com website for show notes and great links. That's all for today. Now go do something amazing.